Imagine you're in another country. You don't speak the language, and you're really sick. If that's difficult to imagine, it's because Australia is the third most monolingual country in the world, and we happen to speak the dominant lingua franca for most of the globe. And yet, more than 350 languages are spoken here. 22.5% of residents speak another language at home, and over 800,000 Australians report low English proficiency. We know that culturally and linguistically diverse patients experience poorer health outcomes, decreased patient safety, and lower quality of care. It is CHS policy to use professional interpreters when caring for these patients. Yet some people are reluctant or uncomfortable engaging a phone interpreter, feeling like it's difficult or takes too much time. We know that one of the ways we can do better is by using formal or accredited interpreters, rather than ad hoc interpreters, such as family, friends, and staff who are not trained in interpreting. Did you know, when we fail to use accredited interpreters, both doctors and patients can remain highly satisfied with the encounter, even when a dangerous mistranslation or omission has occurred. So not only is it not medically or legally safe to omit an accredited interpreter, you won't know when it's not safe. Accredited interpreters are trained in medical language and are bound by a code of conduct that requires them to maintain professional detachment, impartiality, objectivity, and confidentiality. Ad hoc interpreters are not bound by these requirements. Putting it simply, an accredited interpreter is the closest thing we have to letting patients speak for themselves. So now you know why. Here's how. 1. Grab an interpreter phone. In ED, these are on the acute and fast track desks. 2. Speed dial the Translating and Interpreting Services Medical Practitioners line. 3. Quote the client code stuck on the back of the phone. 4. Let them know which language you're seeking. With the interpreter on the line, introduce yourself and set the scene. Place the phone between the two of you. On speaker, direct all communication toward the patient in the first person. It might help to think of the interpreter like spoken subtitles. Don't try to simplify your language. Speak clearly in normal language and don't try to guess which words will be difficult to interpret. If the interpreter or the patient doesn't understand you, they will ask for clarification. It takes less than 3 minutes to connect with an interpreter, and it allows your patient the dignity of being properly understood and clearly and impartially represented. Sometimes family are eager to interpret or are used to interpreting. Thank them for their work. Let them know our policy requires that we use a healthcare interpreter, and encourage them to remain a part of the conversation if this is what the patient wants. They are not allowed to refuse or block an interpreter on behalf of their relative. Remember that by using an impartial, trained, accredited interpreter, you're doing your best to let your patients speak for themselves, and in doing so, you're doing your best to provide equitable, high-quality care.